Penny. She's going to talk to you about primary prevention of breast care. Put your hands together for Dr. Penny, please. So how do we use this? There we go. Excellent. So good morning, everybody. Thank you for the introductions and thank you for inviting me today. It's a very, very special event, this one, and one very close to my heart. So congratulations to Professor Sam and the team and the sponsors. When I got the invite from Professor Sam, I thought, oh my God, this today I have to keep the boys. But I thought this is too important to actually miss, so I brought the boys with me. So if you see two little men just walking around, they are mine. But no, I'm really, really grateful to be here. So I practice breast cancer, amongst other things, and we all know that breast cancer incidence is going up. We know that, oops, what's happening? Why is it moving so fast? There we go. Breast cancer incidence is going up and all ages are affected. Certainly in my clinic, I see more young people presenting and presenting with advanced disease. So we are seeing a biology which has changed, but also the public health presentations. So there's something around the risk factors that we have to actually promote and educate. We know that there is great disparities globally on access to treatment and also outcomes. Breast cancer is very common in developed countries, but mortality is going down, whereas in undeveloped countries is not that common, but mortality is going up. So prevention really is a subject that is very important for us as clinicians to educate, and hence why we are here today. Now, there is some conception that breast cancer is caused by genetics, but actually only a few cases are due to genetics. So lifestyle plays a big role, causing what we call epigenetic changes, which again, there are changes in the genes without necessarily changes in the DNA. The good news are that this can be reversible with lifestyle change, so primary prevention again is key. I really like that slide because it shows how complex cancer is, and it shows really there is a combination of factors that play when a cancer develops or cancer returns, okay? So there are host factors, is how well the body and the mind works, the level of inflammation in the host body, the person's body. It's also the effect of the environment, the environmental impact, the factors, toxins we are exposed to, viruses perhaps, and I'm talking generally now about cancer. And then you've got the diet and lifestyle, what we are actually choosing to put in our plate. And we know that 4 in 10 cancer cases can be prevented with lifestyle changes like the ones here. Eating a healthy diet, stopping smoking, and reducing alcohol, avoid exposure to toxins or air pollution. Enjoying the sun safely. We know the sun is very important, but we need to be also careful about sun-induced cancers. So the World Cancer Research Fund, who has written a lot around prevention, produced a report back in 2018 looking at the factors that may be predisposing people to breast cancer. And they split them up between premenopausal and postmenopausal breast cancer. So you can see there is strong evidence, for example, for vigorous physical activity in reducing risk in premenopausal breast cancer. Interestingly, being overweight and obese in the younger age reduces risk. Breastfeeding, we know, reduces risk. Alcohol consumption, higher birth weight and linear growth increases risk. And this is where the strong evidence lies. There is some weaker evidence around the consumption of non-starchy vegetables in terms of reducing the risk of estrogen-positive breast cancer, probably because of the effects around estrogens. Consumption of food containing carotenoids may reduce the risk, but the evidence is not that strong. Similar picture in the postmenopausal breast cancer. You can see the effect of physical any kind of physical activity. You can see here the difference being that being overweight or obese in adulthood can increase the risk of breast cancer in postmenopausal women. But the other factors apply. So breastfeeding in the earlier ages is protective. Alcohol can increase the risk. So looking at the diet in particular, there is a lot of publications around protective versus what is harmful. And you can see from bottom up, going from most protective factors in the diet versus the most that can be harmful or causing breast cancer. You can see the consumption of fresh fruits and vegetables. Because of the richness in polyphenols, they can help reduce the risk. Same with high fiber diet, probably with soybean proteins, but certainly red wine, red meat, dietary fats have an effect on the degree of inflammation and genetic change, or epigenetic change, shall I say. So how do polyphenols affect? So this is a good diagram, I find, because the arrow, the blue arrow without the circle, is the induction of those protective genes by eating polyphenols that protect you against breast cancer, versus the ones with the red circle around the arrow, which are the induction of the genes that can be particularly harmful. So there is a molecular explanation of what happens when we lead a healthy lifestyle. Plenty of evidence to show that Mediterranean diet, again, because of the amount of polyphenols, is protective. Fruits and vegetable consumption in adulthood is associated with reduced risk in ER-negative, estrogen-negative and HER2-positive breast cancers. And we know that these are the most difficult to treat cancers. Some more evidence around the effects of physical activity. Physical activity, we saw it reduces the risk in both pre- and postmenopausal breast cancer because of its effect in reducing body fat, probably reducing estrogen levels, and reduced inflammation. And it can be protective regardless of the person's body mass index. Whereas alcohol, we can see there is an increase in the risk in all ages. Probably slightly more for postmenopausal women, but still statistically significant for both premenopausal and postmenopausal women. Smoking, again, increased risk in all ages, and again a bit more in the premenopausal women cohort, but also statistically significant for both. And being a passive smoker, very interestingly, also increases the relative risk of breast cancer. We talk about environmental risks. There are plenty, I would say, around us, and sometimes we don't know it's from the kind of utensils we use in the kitchen to cook, sometimes the materials that they are made of, from the makeup that we use. We need to be very careful if we are into the healthy lifestyle to choose carefully all those products, even the detergents that we use to clean clothes, etc. So they contain chemicals, what we call endocrine disruptors, which can affect the balance of our hormones in our body. So the World Cancer Risks Fund has put the recommendations together around primary prevention, and you won't be very surprised that going clockwise, having a healthy weight is protective, be physically active, eat a diet rich in whole grains, fruits and beans, limit the consumption of processed foods, limit the consumption of red meat, limit the consumption of sugar, alcohol, supplements, and promote breastfeeding for mothers. So, lifestyle medicine, looking at the pillars, there are 6 pillars in lifestyle medicine. We talked about most of those. We talked about the physical activity. We talked about the importance of making good options around diet, avoiding toxins. We didn't talk about sleep. So sleep is extremely important, and it is an area where I stress to my patients, certainly to make changes if sleep is not of good quality or not enough. Guidelines say we should be having between 7 to 9 hours of night sleep uninterrupted. Okay, I think there are various factors we can talk about that could disrupt that sleep. Certainly, patients who are undergoing cancer treatment and their treatments themselves can actually disturb sleep, but if we talk about people who don't have cancer for prevention, I think it's important that we have a routine and that we follow before going to bed, not sleep late, not eat late at night, not drink alcohol late at night. Obviously, coffee and any stimulants, even exercising at night, is not particularly recommended. Electronics and any exposure to those mobile phones, again, is not recommended. And by making those small changes, we can actually see good effects in our sleep quality. Social connection. Again, we know that loneliness can increase mortality overall for chronic illnesses, but also cancer. It's really, really important that we feel we belong within a network, I would say, whatever that looks like. Could be a family, could be a friends network, could be here talking to each other with colleagues. And that social connection, again, is really important. And we should be advocating in our clinics for our patients to meet others in forums, and we should be reinforcing that engagement. Now, we talked about avoiding risky substances. I'm not going to go into detail about that. Now, I want to spend the last few minutes just thinking about what we talked about. Okay, we know all of these things, but how to actually apply them in clinic? Well, how do we apply them in our day-to-day lives to advise our friends, to advise our colleagues to lead a better lifestyle for prevention? Okay. Now, this is a dream of mine that I want to see in the UK happening, actually, and slowly, with a number of colleagues, and we are heading towards that. But integrative medicine is about actually combining traditional medicine with lifestyle medicine, complementary therapies. Now, there is plenty of evidence out there, including the ASCO guidelines, the Society of Integrative Oncology guidelines, to show that integration actually improves clinical outcomes for our patients. But imagine having such a program in primary care. Okay? Imagine having such a program within oncology clinics, which patients can go into, and from diagnosis through to treatment, through to survivorship. And that will involve not just the oncologist being on board, but the whole multidisciplinary team. Okay? And it will be about incorporating lifestyle modifications, using techniques like health coaching, and speaking to one of my colleagues here today from the north, and he's talking about coaching approach in clinical practice and how we can incorporate that to empower people to make changes. It's about also understanding the environment of the people, and it could be healthy people coming to clinic, they're worried well, it could be people, as I say, who undergo treatment for cancer, and having the whole family or the whole personal environment working together with the patient to make those changes is more likely to sustain those lifestyle changes for the long term. Integrative medicine or integrative oncology, if we talk about cancer, also is about improving symptoms during treatment and getting people into a better state after treatment. But certainly, if we're talking about primary prevention, that approach, for me, it should be in any clinic, primary, secondary care, pharmacy, in the community, and any opportunity to educate, we should be doing. I'll finish off for anybody who wants to read more about integrative oncology. My colleague Nina and I wrote a book, was published last year, and you can find it in Springer website, and I think that will be very informative for everybody. So thank you so much for listening. Thank you.